My name's Dr. Jennifer Brubaker. I'm a pediatrician at Lancaster Health Center, and I just wanted to take a little time today to talk to you about COVID-19 virus and your children. One positive in the midst of this very difficult time with COVID is that children do not seem to be severely affected by the disease. We now have some good data from the outbreaks in China and Italy, and they're showing us that for the most part, children have only mild or no symptoms with the COVID-19 virus. Only about 2 out of 1,000 children are severely affected that they need hospitalization with this virus. As I said before, most children have relatively mild disease, but the symptoms are similar to what you would see in an adult, which would mean that they could get cough or fever and possibly present with shortness of breath, or some are presenting with some mild abdominal discomfort such as vomiting or nausea as well. So how do you keep your children healthy? Well, you can teach them about good hand washing and try to get them not to touch their faces often. Kids should be washing their hands for a full 20 seconds, and it's often good to sing a song or something during that time to help them be able to wash that long. It's also important to disinfect and clean toys that have been in children's mouths, and to make sure that you're cleaning surfaces as much as possible and using sensible social distancing. But there might be a point when you need to know if your children needs to be brought in for medical care related to the COVID-19 virus. Things you could look for is if they're having a high fever, especially one that's lasting longer than 3 days. At any point, if they're having trouble breathing or respiratory distress, or if they have some sort of severe vomiting where you were worried about dehydration, you would definitely want to contact your health provider and see what would be the best method of getting your child in for care. Even though children are not getting severely physically ill from this disorder, a lot of children are starting to have some emotional distress and anxiety. So it's important to know how to talk to your children about the COVID-19 virus. The most important thing is that you're projecting a calm demeanor when you talk to them. If you're anxious and fearful, your children will pick up on that, and they'll be more anxious and fearful as well. Also, it's important to maintain routine. We're going to potentially get to a point where children are going to be off school for a prolonged period of time. And as much as you can maintain routines such as stable meal times at home, times where they're doing school, times for play, and children know what's coming next, that can really help calm their fears. Children, as we mentioned before, are the least likely to be physically affected by the COVID-19 virus, but it's still important to remember their emotional state. And the more that you can stay calm, keep routine at home, and decrease your own anxiety and fear, you will be able to help your children get through this difficult time successfully.